And ultimately, the first thing that we're going to be doing with the Health Information Network is developing a bidirectional operations between our registry for immunizations and the Health Information Network. So that if a physician is actually seeing a child, let's say, who's getting an immunization in the office and has an electronic health record, that physician can actually input data into the health record and it will cross over into the network. Also, it goes just the opposite direction. If in fact, let's say a person gets an immunization outside of their medical home, in a pharmacy, for example, flu shot. The mother of a child may go to the pharmacy and it's convenient to get the flu shot there instead of at her doctor's office. And the pharmacist who gives the shot then will input that information into our immunization record, which will then cross back over into the electronic medical record of that patient's provider. So it's a bidirectional operation that we're going to be seeing, and I think that's a tremendous advantage to public health. So from a public health perspective, it's going to give us much more complete data. With complete data, I think we can do a better job of taking care of the public's health overall population level. In the future is going to be something that we're going to look at and say, how in the world did we ever practice medicine and deliver health care without this? So the person may have a medical home, but they have an injury. They have a car crash. They're taken to the hospital, to the emergency department. They're treated in the emergency department. The surgeon takes care of them if it happens to be a surgical emergency. To be able to integrate what happens in that setting back to the medical home is going to occur when we have an effective health information network. All of that will be coordinated for a given patient. And obviously, when practitioners have the ability to see the full spectrum of what's being delivered to an individual in terms of health care, that care is going to be better. There's not going to be duplication that's unnecessary. We hope that there will be significant savings in cost as well. And most importantly, we think that patients will have better outcomes. So from a public health perspective, this pulling together, aggregating data, and using that data to affect outcomes is I think that's the future. That's where we're going with this whole opportunity to see changes through health information exchanges and networks. What does it mean to me that care is better when we're connected? Gosh, it means a host of things, but most importantly, I think it means that I recognize, and I hope that almost everybody recognizes, as I'd said before, that no one provider delivers everything that a person needs in terms of health care. It happens in various sites by various providers. And there is an opportunity with that multiplicity of providers for there to be unnecessary cost and unnecessary redundancy, duplicity. I think with this integration that we're going to see with the health information networks, we're going to be able to avoid so much of that. And the yield, again, is going to be tremendous in terms of better outcomes for individuals at lower costs and a better public health in terms of the population being healthier, because we're basically doing a better job of seeing that outcomes are greater for the entire population.